What may be a medical breakthrough in heart disease? What if after a heart attack, instead of permanent scarring, your heart could be healed with the help of a simple procedure using cells from your own body or donated by someone else? It's what two dramatic new studies unveiled over the weekend, and they found what some people hope at least could be the magic bullet. Stem cells, adult stem cells that have the power to heal your heart. Here's ABC's Dan Harris.
After having a heart attack, Joe Gasser is alive and back on the treadmill, thanks to a treatment that is right out of a science fiction movie. Doctors injected stem cells into his ailing heart in hopes of healing it.
It's a second chance.
5 million Americans have heart failure, and nearly 1 million have heart attacks every year. Until now, there have been very few treatments that can help heart tissue repair itself. But in a new study, scientists delivered stem cells to the hearts of 23 patients with heart failure. They found that after 6 months, the patients showed improvements, while those who did not receive the stem cells got worse. In another study, researchers infused stem cells into a patient's heart within 10 days of a heart attack. After 6 months, the patients with the transplant had better heart and lung function.
The patients getting the cells were doing better. Their heart function was better, and their breathing was better as well.
Just look at this special 3D heart map. Here on the left is the heart of one of the patients right after the stem cell injection. The black spots are where the stem cells were injected, and the red spot is an area of dead tissue. Now look at the same heart 6 months later. The red, damaged tissue is gone, replaced by healthy tissue in yellow.
A patient who have no hope today will have hope in the future.
It's a new lease on life for patients like Joe Gasser.
I have lots of energy. I feel good. Nothing holds me back.
For Good Morning America, Dan Harris, ABC News.
And we want to turn now to ABC's medical editor, Dr. Tim Johnson. Tim, two studies, one using your own stem cells, the other using someone else's. What was the difference in the two?
Well, the ones where the patient's own cells are used are the heart failure patients. They have time to take cells from the leg muscles, grow them in the lab, and then using that fancy imagery that you saw, inject them directly back into the scar tissue in the heart. In the case of the heart attack patients, where time is of the essence, they use cells that have been gathered from donors, so they have them readily available on the shelves and can put them in with an IV infusion. But in both cases, it is adult stem cells doing some really remarkable work. I talked to the veteran grizzled cardiologist I've known for years who moderated the presentation yesterday, and he was genuinely excited about these studies.
So these were significant improvements?
Significant improvements, yes. They can measure the improvements, and they can obviously, almost more importantly, see the improvement in the way the patients can function. And
when might it be available for everyone?
Well, these were small studies, phase 1 studies, so they got to go through the whole process. Both researchers in both studies were saying probably 3 to 5 years if everything goes well. So not immediately, but not that far off in the future either.
Will it be hugely expensive?
Well, we don't know yet what it'll cost, but if it can replace very costly treatments we now use, including heart transplants for heart failure patients, it could turn out to be actually cost effective. That is, save money.
And do we know everything yet about side effects, particularly if you're using someone else's stem cells?
In this initial study, amazingly, the donor cells did not seem to cause any problems, and that's obviously good news because that was one of the concerns.
Well, this is really a red letter day for fighting heart disease in this country. Thanks a lot, Tim.